What do you guys got? Possible overdose. There's some stuff sitting on the table there. Can you wake up for me?
I think the best definition of addiction that I've ever heard is an irresistible urge to perform an irrational act. An irresistible urge to perform an irrational act.
Over 2 decades ago, painkillers derived from synthetic morphine were seen as a miracle drug for patients coping with chronic pain. Since then, numerous forms of synthesized narcotics have made their way into doctors' offices and pharmacies. According to the Centers for Disease Control, as the number of opioids increased, so did addiction rates. The Trump administration has declared the problem a public health emergency.
They hit people with suits, with dresses, indiscriminate. But because the perception of risk were down, it was like inviting the drug dealer to your child's birthday party. You know, they were just handing them out because it was supposed to be thought of as a good thing.
In 2015, the CDC reported over 33,000 deaths nationwide related to opioid overdose. Over the past 2 years, that number has more than doubled.
It's hard not to look at it as a war. We've gone from 64,000 people dying in 2016 to 72,000 in 2017. That's over a 10% increase in fatalities when we know what the problem is, when we have a grasp of this problem of opioids. So there has to be some deeper issue systemically.
Wake up for me, dear.
Those developing the strategies to fight opioid misuse are fighting a war on 2 fronts. One is availability. Officials with the Iowa Governor's Office of Drug Control Policy are concerned medicines like Percocet, Oxycontin, and other fentanyls have a safer persona than illicit drugs. Komendowski believes that safer persona creates a climate for addiction. The other front is the amount. Federal government officials contend, with a perception of low risk, opioids have been prescribed in ample amounts, with little concern for misuse. Making physicians aware of how many pills are being written into prescriptions is one way opioid misuse is being confronted.
Previously, you'd see a prescription come in maybe for 60 tablets. Now we're seeing more prescriptions written for 30.
As a licensed pharmacist
Bring that with you, though. Okay.
And legislator in the Iowa House of Representatives, John Forbes uses his unique position to help craft legislation aimed at helping curb opioid misuse in rural Iowa. But Forbes knows he and his colleagues on the other side of the pharmacy counter are on the front lines of fighting the epidemic.
Pharmacists just need to be vigilant whenever they have a prescription presented to them that they have questions about.
A tool pharmacists use when a suspicious prescription comes to their attention is the Prescription Drug Monitoring Program. Established in the 1930s to track Schedule II narcotics, the program has evolved to an electronic database stretching coast to coast.
We check that database on new prescriptions, especially patients that are new to our pharmacy, to make sure they're not doctor shopping or going to multiple pharmacies to try to obtain controlled substances.
Last year, the Drug Enforcement Administration stepped in to help slow the opioid epidemic by allowing pharmacies to partially fill prescriptions.
A program like this helps keep larger quantities of opioids out of the system, so there's less chance for diversion.
Let's go ahead and give that Narcan. Narcan. Verified.
A life-saving drug helping addicts who have overdosed is a medication called naloxone or Narcan. This product can bring someone out of an overdose in minutes, but it also has a high price tag.
Narcan going in at $15.07.
One dose can cost up to $100, which can strain small-town budgets. And it comes with one important caveat.
It's an opportunity to treat and care for somebody, to intervene. It's not a cure. And that's the biggest misconception we see with naloxone.
One place that treatment and care can be found stretches over a 7-county area in north-central Iowa. Prairie Ridge Integrated Behavioral Health Care in Mason City is a treatment center exploring new ways to help people cope with addiction, combining mental and physical health services with recovery treatment. The center uses state-of-the-art technology and strong doses of compassion to help shrink misuse disorders in rural Iowa.
That's the thing we have to keep working on, is to make substance use and mental health treatment part of our healthcare system, not something that's viewed by the public as a weakness or a moral failing. It's a biochemical brain disease, and it's really time that we focus on that as opposed to an act of willpower or lack thereof.
And when the consequences hit American culture anywhere, low population, rural areas where the density is low, they have the least amount of health care, the least amount of counseling, the least amount of resources for public safety, they're at risk for much longer than where we can apply all the big money and resources.
All right, she's waking up a little bit. What's your name?
Tiffany.
Officials in the Hawkeye State see a long fight ahead that will require a balance between limited funding and scarce resources. They also believe to win the war will demand an increased respect for the medicines being prescribed. For Market to Market, I'm John Torpy.